Well, it's the leading cause of death in the United States, but there may be hope in reducing the risk of heart disease thanks to a new medication. Dr. Deepak Bhatt is here to explain. All right, Doc, let me ask you this. First, why are so many Americans at risk for cardiovascular disease?
It's a terrific question, and it starts with the basics, things like lifestyle, a diet that's unhealthy, and lack of physical activity leading to things like being overweight, high blood pressure, diabetes, high cholesterol, and those are risk factors for heart disease. So if those risk factors are present and as people age, heart disease develops.
I like that you mentioned diet there, because diet is obviously the first preventative measure, but how does somebody know, based off their diet or their risks, how do they know if they're at risk for this?
Well, really best to assume that you're at risk for heart disease. It's so common, as you alluded to initially, and it's still the leading cause of death in America, for that matter, worldwide. So cardiovascular disease, broadly speaking, is the leading killer, and therefore it's best for people to assume they're at risk and just baseline adopt a healthy, typically plant-based diet and engage in daily physical activity. That's good to reduce the risk of heart disease, but it's also good to reduce the risk of things like cancer.
No doubt. All right, so tell me about this new medication and the advancement.
Absolutely. So I think most people know that having a high cholesterol is bad. It raises the risk of things like heart attacks and strokes and dying from those causes. What we did in a large study called Reduce It was examine people who were at elevated risk of heart disease, who were already taking statins for their cholesterol and had good cholesterol control, but who had elevated triglycerides. And triglycerides are a different type of fat in the blood, different from cholesterol, kind of related, but not exactly the same thing. And what we found is when these people got icosapent-ethyl, a prescription medication, a prescription omega-3 fatty acid, that these people were about 30% less likely to have heart attacks and strokes or die from those causes. And in fact, the FDA recently approved this drug for the purpose of reducing cardiovascular risk in people with elevated triglycerides and other risk factors for heart disease.
All right, so how should somebody go about accessing this and getting the cost benefits as well?
Sure. So really the first step is to know your triglycerides. I think most people these days know their cholesterol, or if you don't know your cholesterol, you should know your cholesterol. You should know your cholesterol, you should know your sugar, you should know your weight, you should know your blood pressure. So those are basic things about your health that everybody should know, even if they're healthy people, certainly if they're patients with actual diseases. But beyond that now, I would add to that list triglycerides. And it's easy to measure because every time someone gets their cholesterol measured, well, the triglycerides are measured too. But the problem is that doctors have been ignoring triglycerides for years, largely because there wasn't any effective or proven therapy that both lowered triglycerides but also reduced heart attack and stroke risk. But now, with icosapent-ethyl, we've got something. So really, the key, I would say, is to know your triglycerides and then to talk to your doctor and see if you're eligible for this new therapy.
All right, sounds good. Great information. Where can our viewers read more about this?
Sure. So if they want to get the details, the main trial was published in the New England Journal of Medicine, so it's available there in terms of details. But in terms of practicality, really, this is a prescription omega-3 fatty acid, so it isn't something that you can buy in the store as a supplement. Those are totally different. There are omega-3 fatty acid supplements, but those haven't ever been proven to reduce heart attack. What we're talking about here is a prescription omega-3 fatty acid, and for that, you have to go see your doctor.
All right, appreciate it. We're going to share this on our website a little later, so you can check it out again. Just go to firstcoastliving.net.